If you are a woman and your rhesus factor is not compatible with that of your husband or maybe that of your friend that you are intending to marry, it can lead to the death of your baby. So what I mean by rhesus factor is that positive or the negative sign that is attached to your blood group. Yes, for instance, some people, their own is A positive or B positive or A negative or B negative or O negative or thereabout. So if you are a woman and your own is negative, it has negative attached to it, that it means you are rhesus negative. So if you now get married to a man who is positive, it can lead to the death of your baby, especially if the baby happens to inherit the rhesus positive factor from the father. You as the mother, your immune system will start to produce antibodies that will fight the baby and destroy the baby's red blood cells. I've already made a video on this, but I decided to go deeper because I received certain questions. You know, a lady is asking, I am O negative and my fiance is O positive. Does it mean that our rhesus factor are incompatible? From what you have explained earlier, it is yes. She now says, is it possible for us to get married and have kids successfully? The answer is also yes, but certain things has to be done in order to prevent the harm of your babies during pregnancy. There is an injection we call Rogam. It is an anti-D immunoglobulin injection. How it works is that it destroys the fetus rhesus positive cells before the mother's immune system recognizes them. The Rogam injection is given at 28 weeks of pregnancy. Why it is given during pregnancy is because the doctors in charge do not really know whether the baby inside the womb, that is the fetus, is rhesus positive or rhesus negative. So Rogam is just given as a preventative measure to all rhesus negative insensitized mothers. This is because a small amount of the fetal blood can get into the mother's circulation even before the delivery of the baby. Rogam is also given 72 hours after the delivery of a rhesus positive baby. Rogam is also given to all rhesus negative women when they undergo any event that can cause the fetal blood to, enter into the mother's circulation, something like, miscarriage, abortion, or ectopic pregnancy. So somebody is also asking, does this death of baby occurs in every pregnancy where a rhesus positive man marries a rhesus negative woman? Well, the answer is no. The rhesus factor a baby has is determined by genetics. It is determined by the gene that the baby inherits from both parents. If he inherits the rhesus factor of that of his mother, then there will be no problem. That is, if he inherits the rhesus negative factor from the mother, then there will be no problem. But if he inherits that of his father, that is where the challenge will come in. That is where the mother's immune system will start seeing the baby as an enemy, and then they will try to fight it. So somebody is also asking, what can I do? I am a woman and I am rhesus negative, and my husband is rhesus positive, and my first issue is rhesus positive. But I did not take Rogam injection because of the fact that I have not come across this kind of information. Will my subsequent pregnancies be safe? Well, something has to be done, because once you have been sensitized, this Rogam injection cannot work again. It will no longer be effective. So when you come to the hospital, we do what we call antibody screening and titration, where we check the level of anti-D antibodies present in your body. If it is low, the baby inside the womb might be safe. We also monitor the baby closely for anemia, that is loss of blood. So if you are sensing it, there's what we call an intrauterine blood transfusion, where the baby inside the womb is given blood. Then if the baby is mature enough and the anemia is worsening, the doctor in charge can induce labor, and then you give birth to the baby. But note, early antenatal care is the key to the baby's survival. So if you did not get anything from this video, one point I want you to get is for you as a pregnant woman to go and register for antenatal. Antenatal is very important for all pregnant women, especially for you as a rhesus negative woman. Go and register for antenatal. Don't say I did not tell you. I know you got a lot of points, a lot of information from this video. Thank you for subscribing. You can also ask your question on the comment section and then share to your loved ones. Bye.